Hi, I'm Dr. Jennifer Gaudiani. Thanks for joining me again for a reading from my book, Sick Enough. Today we're going to be reading from the box called Naming Privilege and Challenging the Narrative from the chapter, let's just see which chapter it is, from chapter 10 in the book. Some colleagues in the binge eating disorder field recently gave me the gift of their time and teaching. They expressed frustration with the medical profession because of all the harm it has done to patients in larger bodies, pathologizing body size, contributing to constructs of an epidemic, and promoting the typical doctor advice of just eat less than you burn. I'm sorry to say that in the past, I too participated in this kind of thinking and patient advice. I never thought about my own thin privilege. It didn't occur to me to consider how my growing up white, cisgender, financially secure, with two loving and educated parents, time and resources for family dinners, generations of Italian ancestors dedicated to the art of delicious and nutritious food served in an emotionally engaged setting, and an able body might have contributed to my own ease with body and food. There are at least two major problems with the advice: take in less energy than you burn. One, it's not actually scientifically sound. We saw in earlier chapters that patients with anorexia nervosa who are going through nutritional rehabilitation often have to eat vastly more calories than predicted because of hypermetabolism. Other patients across the eating disorder and body size spectrum have learned that no matter how much they restrict calories, their body weight just doesn't change. Their cave person brain defends their body weight through metabolic slowing, just like they were designed to do. I have fielded questions from doubting physicians who ask me, okay, you say diets don't work. If that's so, then why aren't there prisoners of war whose body weight resisted starvation? They're all emaciated. There are a lot of things wrong with this question, but I've been asked some version of it many times. The answer is that people in society do not live in literal prisons. We are genetically programmed to seek out food when we are starved. And unlike prisoners of war, most people have some degree of access to food. Even if so-called excessive food isn't consumed after deprivation, metabolic slowing will cause the body to need less energy and store any extra. Think about it from the perspective of a person deprived of water. Their thirst will rise and rise. If water is available, at some point they will drink. It's not willpower, it's biology. 2, the development of society's current size demographics doesn't emerge from a lack of willpower or inadequate dedication to dieting, as physicians can imply in their advice. It emerges from a society-wide construct of racist, sexist, and classist policies and ideologies that are promoted by a highly profitable food industry and a booming dieting and supplement industry. Highly palatable and less nutritious foods are consistently marketed more to poor communities of color than to upper-class white neighborhoods. The food industry sells Black and Latino folks triple-sized donuts at the gas station and triple-decker burgers for just $1 more, then puts up billboards for commercial diet programs and magazines inserts for the magical pill that will burn fat while you sleep. It broadcasts commercials of light-skinned, thin women cavorting around looking like they feel worthy and confident. The industry powerfully draws out people's insecurities in order to sell them the solution. The same companies that make skin whitening creams in India, advertising them through photoshopped images of lighter-skinned women who look financially secure, sell skin darkening creams in North America, where glowing beach beauties show that pasty skin is for losers. These are the reasons that social justice advocates and binge eating disorder advocates have paired up so harmoniously to make their voices heard. One of my colleagues in the binge eating disorder field spoke of their frustration with needing to educate doctors about all this because doctors are so resistant and have been responsible for so much pain and suffering in patients of size. I said to her, But not all doctors are like this. A lot are really open and would like to know more about this stuff. I was called out properly on my self-regarding response. I realized that what my response had missed was my recognition that even if I personally do not espouse sizist views, I'm still a physician. I'm a representative of a class that has traditionally played an oppressive role, even if unwittingly. There has to be awareness of this and the privilege that goes with it for society to change. The better insight is, it's not about me specifically. It's about the bigger picture. This requires me to name that privilege and recognize the delicacy of the position of power that I hold. It requires me to think about how I can contribute to dismantling the potential for future damage that my profession will cause to patients in larger bodies. All of us with privilege must consider how we can challenge the narrative and change the system. Thanks so much for joining me today. Take care of yourself.